Hello there. Another busy day. I'm Mia Gradney with your news at 5. And our top story today, the clinical trial results are in for Astrazeneca's 2-dose vaccine, and it is good news. Researchers say it not only protects against COVID-19, it also reduces its spread. This comes as states are working hard to vaccinate the public. As you can see, a small number of states have more than 9% of their population vaccinated as of today. Texas has less than 7%. Stephanie Whitfield has more on the impact the AstraZeneca vaccine could have on these numbers.
Studies have shown Pfizer and Moderna's vaccines are very effective in preventing symptoms of COVID-19. But AstraZeneca's trial is the first to test whether it prevents asymptomatic spread.
AstraZeneca's COVID-19 vaccine could be a game changer for a few reasons. The 2-dose vaccine can be stored in regular refrigerators, and early trial results show it may reduce transmission of the virus. AstraZeneca's phase 3 clinical trial followed more than 17,000 volunteers. There were no hospitalizations. The vaccine was also 76% effective in reducing symptoms after the first dose. When volunteers waited at least 12 weeks to get a second dose, efficacy rose to 82%. Pfizer and Moderna's vaccines are 95% effective, but the longer time between AstraZeneca's doses could have logistical advantages. Dr. Michael Chang is an infectious diseases specialist with UT Health.
So the reason they had the big gap was because they couldn't make enough or get enough of it to get all the vaccine participants vaccinated within kind of their original time frame. But what it does say now is that it is plausible that you use the first available doses, you vaccinate a larger part of the population now, and then when your vaccine supply becomes available, you give people the booster dose, 12 weeks or more later.
Here's the other big takeaway. Volunteers in the UK did weekly nose swabs. The study found people were 67% less likely to test positive after one dose, which means they aren't spreading the virus. The other vaccines may do that too, but their trials have only analyzed symptoms, not transmission.
The AstraZeneca vaccine is already being used in Europe and India, but the company hasn't even filed for emergency use authorization with the FDA, so it may be months before it's rolled out here. Stephanie Whitfield, KHOU 11 News.